Good morning, everyone, and welcome. By the way, I just checked the heat index. It is now 92 at 8:30 this morning. So this is technically the coolest part of the day. So when it hits 102 later in the day, we can look back fondly at this cool part of the day. Anyway, I am Bill Salmon, Senior Vice President of Editorial Content at The Hill. I'm so delighted that you're here. I want to thank everyone for joining us, whether you're online or whether you're in the room, for today's program, which is titled Matters of Life and Breath, Championing COPD Care. I especially want to thank our sponsor, AstraZeneca, for their generous support in making today's program possible. And the program, of course, is about COPD, chronic obstructive pulmonary disease. It now affects 25 million people in the country. It is the fifth leading cause of death from disease, on track to become the third leading cause in the next decade if nothing changes. And that's because we have problems surrounding COPD, whether it's gaps in treatment, whether it's access barriers, and whether it's just a sort of general policy inaction. All of these things lead to bad outcomes, whether those be elevated rates of emergency room visits, or hospital admissions, hospital readmissions, or worse. The bottom line is that with 150,000 deaths per year and direct medical costs now approaching, I think, $31 billion a year, COPD remains a very big healthcare crisis, albeit one that is under-prioritized. So what can we do about it? How do we tackle the problem? I think the first thing is we have to look at some of the basic questions surrounding COPD, and I wrote a few of them down, starting with this. Will the Trump administration breathe new life into COPD care? How should gaps in treatment be addressed? How can public-private partnerships improve patient outcomes? What does a comprehensive COPD policy framework even look like, and when can we expect it? And in the meantime, and perhaps most importantly, how can patients with COPD prioritize their own health care, especially on a day like today? Fortunately, we're going to get some answers to these and other questions from the incredible group of lawmakers, policy experts, COPD advocates that we've assembled for today's program. And we're going to have a great discussion about that. But before we get to that, before we unleash these people on you, a few housekeeping notes. One, if you're in the room, please keep your phones, if you would, on silent for the duration of the program. That said, please do join us in the conversation on social media. You can follow us on Facebook, X, Instagram, at #TheHillEvents using hashtag #TheHillHealth. Let me repeat that. #TheHillEvents, hashtag #TheHillHealth. And by the way, can I just take a quick moment and acknowledge one of my journalistic icons? Mr. Ted Koppel is in the house, so it's such a pleasure to finally get a chance to meet Ted Koppel. So thank you for coming, Mr. Koppel. I'm geeking out. I got to meet Ted Koppel. This is great. My day is complete. But anyway, now without further ado, let's kick off today's program with our special sponsor segment from AstraZeneca. Thank you.
Good morning, everyone. My name is Kathleen Koch. I'm a best-selling author and longtime Washington correspondent. And joining me today is Liz Bowden. Liz is Vice President, U.S. Respiratory and Immunology with AstraZeneca. So welcome, Liz.
I'm so thrilled to be here. It's great to see the turnout for this important discussion this morning, despite some rather warm weather here in D.C. So it's great.
Well, you know, those numbers that Bill shared with us, those were really sobering, right? And I'm curious how many in the room know someone with COPD or have some personal experience with it? Let's see. Wow, it's probably about half, yeah. Right? At least. So obviously you folks are very familiar with it, but many in the room may not be, as well as folks watching. So Liz, could you help us understand what exactly is COPD?
Yeah, so COPD stands for chronic obstructive pulmonary disease, and it's a chronic progressive lung condition. And for most patients, that manifests as breathlessness, chronic cough, fitting, and fatigue. And so it's a disease like we just talked about that affects 25 million Americans. And I think really the reason we're all here together today is because despite the high prevalence of the disease, in many cases it remains underdiagnosed, or in some cases misdiagnosed, or diagnosed later in the disease progression. And so
Why is that?
well, it's sometimes due to the nature of the disease and how it presents. But what ends up happening as a result of that, Kathleen, is we see, the statistics are kind of staggering. Almost 2,000 hospitalizations every day in the United States, almost 4,000 or more emergency room visits, and 380 Americans die every day from COPD. So it's really a challenging and complex disease to manage. But I really think that when we come together, like we are in sessions like this, we can think about the best ways to tackle and improve the management of the condition.
So I know that it is like so many respiratory conditions generally caused by smoking, but smoking is not the only cause.
Yeah.
So help us understand that. I think, 27% of those suffering with COPD never smoked?
Yeah, and
cigarettes, I should say.
And smoking is a contributing factor, but you're absolutely right. There are other contributing factors to this disease. And I think the smoking part of it adds to some of the complexity, because as we know, there's sometimes stigma associated with that maybe leads to some of the challenges of delays in treatment or lack of urgency to act. But for some patients, it can also be a byproduct of occupational hazard, environmental hazards, genetic components that all can contribute to COPD. I actually even think about, on a day like today, how environmental factors can also make it worse for patients. With high heat index, we often see low air quality. And when there's low air quality and pollution and challenges, often the very first people to suffer are people experiencing respiratory ailments. So, as an organization, AstraZeneca, we're really just passionate about being in this space of advancing care for patients with COPD, and also making big commitments about what we can do around the sustainability front for the health of the planet, because it's really our passion for what we're trying to do on behalf of patients and the physicians and healthcare providers who help advance care and get the right treatment patients need.
Well, there's so many connections, right?
Yeah.
I mean, you think about when we have these days when it's bad to go outside, right, because of smoke. Smoke from wildfires in Canada, whatever. And so that's got to make it terrible for people with COPD, but also more likely that more people will develop it.
Yeah, it's really more like an exacerbating factor for the disease. So, you asked about the question about COPD. I'm sure many patients, also people in the room here, either know or experience asthma. What variety of lung conditions just can be made worse by air quality challenges.
Why is it so deadly?
So, we talked about it's the fifth leading cause of death in the U.S. And it's, I think part of the challenge that we see here is there's this 25 million Americans, about half of those patients remain undiagnosed. And so it's a bit of the nature, Kathleen, of the disease when patients are struggling to breathe. It's interesting because when patients are struggling to breathe, what you'll often hear is they start to compensate a little bit. If I'm not breathing as well, maybe I just start to do a little bit less and I start to manage my life a little bit differently.
So they don't automatically think, oh, I should call my doctor and see what's wrong.
Right. And so as a result, the disease can progress and perhaps remain undiagnosed, like we were discussing. And that can delay treatment. And what happens is when patients aren't managing the disease effectively, it can lead to more flare-ups or COPD exacerbations. And that's what results in the visits to the emergency room, the hospitalizations. And the challenging part with this chronic progressive lung disease is that with each exacerbation or flare-up a patient experiences, there's a loss of lung function that cannot be regained. So this is one of the reasons that we're so passionate about getting patients on the right treatments at the right stage in the disease so that they can avoid those, honestly quite frightening exacerbations that lead to these visits, and just the day-to-day impact this disease has when you're struggling to breathe. So that's, I think, a couple of the factors that contribute.
So quick question, I know we hadn't planned on this, but I understand it impacts women more
It does.
than men. Why is that?
I think that, we probably can speak to the medical community who's here today, and they can share a little bit about the science behind that. But I think there is a perception that it's more men than women. And I think, again, awareness and education is a big part of why we're here together today and the work that we're doing, because we need patients recognizing, women and men, that this is something that they should be mindful of and that we should be treating aggressively and early.
So I know that public-private partnerships are often so critical, in advancing public health issues. Is that something that would be helpful with COPD?
I mean, absolutely. When it comes to any chronic and complex illness, I don't think that one organization alone can solve the problem. And so I think that's exactly the case here when it comes to COPD. The statistics on the impact on patients is staggering, but also the economic impact. You quoted the numbers at the beginning, but the projections are within 4 years, COPD costs are going to exceed $60 billion. And that's just COPD, not to mention that with a condition like this, the surrounding impact on comorbid conditions. So I think that coming together across private and public sectors, together with advocacy groups, I think that's when we can put the best minds together and determine what can really be done to break down some of the challenges that are standing in the way of patients getting the treatment that they need, some of the barriers that we've just discussed, not to mention some of the health disparities that impact us in this space too, whether that's socioeconomic factors, access to care, racial disparities. I really think it's the only way we're going to make impact in this space is through the continued work and partnerships.
It sounds like such, a disease that, as you mentioned, how severe it could be as we look into the future. But I thought fewer people were smoking today than ever before. So it seems counterintuitive.
Yeah, and I think that it again goes back to education. I think a ton of education has been done about the importance of smoking cessation, the adverse effect of smoking on your airways and your lungs. But to one point is that there are other contributing factors to the disease. But I think that it's through continued work and education that we need to do on all these fronts that we can make an impact.
Why are you pushing so hard now? Why is it important that, I know we're going to have a representative of Congress here to chime in, but the policymakers, like the one we'll hear from today, and that the public sector join the private sector in this fight?
Yeah, I think that it was back in 2017 that the National Institutes of Health did the update to the National COPD Action Planning. And I think it's timely now with HHS's focus on chronic diseases that we need to make sure COPD is at one of those top priorities when we think about chronic diseases. You saw the hand raised in this room, the number of people that we know, that we love and care about are impacted by this disease. And so I think it's timely with this focus on chronic diseases to make sure that COPD is prioritized.
And so what can those in the room and those watching do to raise awareness? Because it really struck me when you said that when you have these events, you never get that lung function back. So early diagnosis is just critical.
It really is critical. And so I keep coming back to education, right? Education, timely medical interventions for patients to get the guideline-directed medical therapy that they need, and for the entire surrounding healthcare ecosystem to help support those needs through patient education, through the resilience we need in our healthcare systems to be able to manage chronic diseases like this and follow patients over time. These are challenges we face with a lot of chronic diseases, but it's certainly something we see and is amplified in the COPD space.
Liz, thank you so much for helping us better understand this serious disease that's taking such a toll on so many Americans. So join me in thanking Liz Bowden, Vice President, U.S. Respiratory and Immunology with AstraZeneca.
Thank you. Thank you.